Hello and welcome to the Symposium on Healthcare Value Analysis and Infection Prevention. I'm Kelly Pyrek, editor and publisher of Healthcare Hygiene magazine. I invite you to explore with us the key issues that these two disciplines can address in a challenging healthcare landscape. We've gathered thought leaders from across the country to share their expertise with you, and we hope you'll find the sessions to be a springboard for further dialogue at your institution. No important undertaking like this symposium is conducted alone. We appreciate our incredible speakers for their hard work in preparing their presentations. We also thank our partners in this endeavor, the Association for Healthcare Value Analysis Professionals, AVAP, the Pierce Foundation for Scientific Endeavor, and the Environmental Services Optimization Playbook, ESOP. We also acknowledge generous underwriting from Cintas Corporation, which made this program possible. As a reminder, this symposium will be available on demand for 90 days in case you miss any portion of the program. If you have any questions, please email me at kelly@healthcarehygienemagazine.com. Thank you for your participation, and please stay tuned for more symposia to come this year.
Well, good day, everybody, and welcome to the session, Healthcare Textiles and Laundry-Related Imperatives. My name is Lynn Seaholster, and I'm going to do part one of our presentation, followed by a session with Dr. Michael Overcash. For my part one, it is Principles of Clean, Healthcare Textile Issues for Patient Care and Environmental Services. All right, let's begin first by exploring the concept of hygienically clean versus sanitizing and disinfection. And so we have two guideline entities, that of CDC and the other of the American Association for Medical Instrumentation. Both have definitions for hygienically clean, as you see on the screen. You'll notice that between the two of them, they are speaking of this concept in rather broad terms. Also, you'll notice that there is no quantification given in either of these, and I think that's probably wise because there's so many variables given in the environmental services world, where we deal with a variety of surfaces. We deal with hard or soft surfaces. So when we talk of healthcare textiles for use in environmental services, we're primarily talking about cloths, wipes, and what did we have there? And mops. It almost looked like an N there at the screen there. Now, there are lots of choices of fabrics and types of cloths and wipes to use. They can either be reusable or disposable. And as I mentioned, different fabrics, fibers, other materials can be incorporated into these items. I think the choice of what you decide to use will depend on the properties of the surface to be cleaned, the type of chemical disinfectant or sanitizer that you choose, how you actually apply this chemical to the cloth or the wipe, and the physical process to apply the chemical to the surface using that cloth or wipe, and the contact time, which is how long that product remains on the surface. Now, one thing is certainly true. There are probably more disposable wipes being used in healthcare right now, and many of these come already pre-saturated or at least moist with a disinfecting chemical. And so you'll find these are as commonly used as disposable wipes. But the reusable fabrics, such as cotton or microfiber cloths, are typically provided dry and a chemical is added to them for application to the surface. So, as I mentioned, you can have a variety of choices, but the characteristics of the cloth material for disinfection will make a difference in how successful your process will be. You can choose among woven fabrics, durable fabrics like cotton cloths, which release lint and particles by virtue of the fabric and how it's woven. But as a natural fiber, it absorbs a great deal of liquid, but we also find that it can bind quaternary ammonium compound disinfectants. And so you have to be aware that if you allow, say, a cotton cloth to be in a solution of quaternary ammonium compounds, they could actually remove the active material of the disinfectant out of solution. So you have to be aware of that. Microfiber, very popular, and probably the one that is used more frequently in healthcare, can be composed of either a blend of polyester and nylon, or could be 100% polyester or nylon, whatever. We find it is very effective at removing contaminants on surfaces due to the positive charge of the microfibers themselves. They are absorbent because they have a high surface area. They are very strong and absorbent. They are excellent for use on a variety of surfaces. But I think the woven fabrics are probably that which are used more frequently. Okay, that's about all I want to say from the environmental services point of view. Let's go to the laundry process for either in-house laundries or laundry contractors. We are talking in this case of using the process for reusable healthcare textiles for patient care. And so the important thing to realize that the laundry cycle is by itself similar to cleaning in the environmental surfaces, which is, it is a physical form of disinfection, but it produces a hygienically clean product. So the important thing to remember is that the wash cycle itself has several steps. First is the actual wash cycle as a whole, which combines the elements of water temperature, an initial rinse, a detergent stage with agitation. Now, many people have thought that, oh, I've got to wash my healthcare textiles in hot water. And that used to be the only thing, the only game in town many years ago. But with more research and innovations in laundry chemicals and laundry equipment, there has been a move to lower temperature water for the laundry cycle. And this does two things. Number one, for, shall we say, sustainability purposes, when you are moving to a lower temperature, you are requiring less energy to produce water at that temperature compared to trying to get a boiler to produce 71 degrees centigrade water, which takes a lot of energy to do. So that's very helpful. There'll be something I'll talk about in part 2 of the presentation, where using a lower temperature wash cycle is also advantageous from a sustainability point of view. But people would say, would the cleaning process, this laundry wash cycle, rinse, eventually then tossed in the dryer, would this still be able to remove or inactivate microorganisms on the fabric? Well, the concern It's a valid concern. And what is recommended is that you adjust the other parameters of the cycle, as you see demonstrated in this 3-slice pie. You adjust those parameters to compensate for the change in temperature. For example, with agitation and duration, you can lengthen the cycle for more agitation in the cycle, or you can switch the laundry chemistry out to include perhaps the use of a sanitizer or a disinfectant at the end of the cycle. So you can compensate for changes made in the major parameters of the wash cycle to effectively have soil removal and microbial reductions at the end of the wash cycle. All right, one thing that is certainly true, we have had decades of experience in, shall we say, laundering reusable textiles, both in the US, the UK, Australia, New Zealand, and elsewhere throughout the world. And overall, it is my opinion, and I think the literature certainly bears this out, that the modern laundry cycle, with its chemistries and equipment, have an impressive track record for the safe production and use of reusable textiles for the medically competent patient population. Now, by that, I mean people who, if they were exposed to minimal numbers of bacteria or viruses or fungi, but they have intact skin and a robust immune system, that fabric poses no problem for them. In order to produce a safe fabric, however, I think there is a key requirement. After the laundry is washed and dried, there must be efforts or steps taken to prevent inadvertent environmental microbial contamination of those laundered textiles as they go from the laundry facility to the healthcare facility and into the storage area of that healthcare facility. From there, people come down to the storage area and move whatever they need to take up to the various floors. And there are many opportunities for inadvertent contamination to occur. I would say back in 2015, when I produced a review article of this phenomenon, we found that there were reports of healthcare acquired infections attributed to laundered textiles. And at that point in time, there were several outbreaks that indicated at least 350 patients were affected in these outbreaks around the world. So these are not patients exclusively in the US or the UK or Australia or so forth. This is in some of the countries in the Far East, some countries in Europe. They're scattered all over the world. But only 350 patients in the last, at that point, 43 years. And that's really quite remarkable. To date, however, since 2009, we're aware of at least 3 published outbreaks of healthcare-acquired infection that are diagnosed as infections due to the fungus mucor. And these infections are occurring among severely immunocompromised patients, that is, among bone marrow transplant patients, pediatric patients in NICUs and pediatric units, solid organ transplant patients. This is a very narrow at-risk population compared to the general healthcare population. But when these outbreaks occur, they're quite devastating. And so since there have been now several outbreaks that have come to our attention, it convinces me that I think we need to consider additional steps in preparing healthcare textiles that are safe for this patient population. And it is in the sort of a discussion stage at this point, getting ideas from various healthcare professionals on how they think we should enhance the safety for this at-risk group. Actually, I think this is where I will, shall we say, pass the baton to Dr. Overcash for his first 15-minute segment. So, Michael, the floor is yours.
This is Michael Overcash, and I'm going to pick up where Dr. Seeholzer just finished. She discussed, of course, the important issues around laundry and how reusables are reprocessed. I'm going to step back a little bit and put in context the broader issues, which is that they are disposables and reusables, and how might we make decisions in that regard. So, of course, when we talk about healthcare textiles, both reusable and disposable, there's really quite a variety of these textiles available. There's, of course, the gowns, which are isolation gowns, patient-related, surgical gowns, as you can imagine. We have incontinence underpads. We have, for the environmental services, we have flat mops and wipes as the principal healthcare textiles. And then in the OR, we have reusable and disposable tapes. So as I mentioned, these are available as either single-use, disposable, or as reusable products. And so the central issue is, how might we compare these alternatives and then look at the selection process that healthcare, that hospitals or long-term care facilities undergo as they try to make their path forward in terms of using these healthcare textiles. As a little bit of a background, the context of deciding single-use versus healthcare, reusable healthcare product involve some major factors, and the three principal ones are shown here in no particular order, but one is the health risk, the relative risk of using one versus the other in terms of the patient and or the healthcare professionals. Cost, of course, is another one. We can think about annual costs. And then environmental sustainability, the whole concept of circularity, decarbonization in the healthcare arena are a third factor. So I'm going to begin and talk about the healthcare risk factor. We'll do that first. And as a background, the theme of risk, the common healthcare theme that goes towards selecting disposables, is that the reusable systems, the textiles, if you would, pose a significant healthcare risk to the patients or the healthcare professionals. Now that's kind of in the background, but when you look more carefully, you realize there's actually no data that have been provided. There are no studies in journals that have offered to quantify rather this perception, if you would, or this statement that the reusables have a significant healthcare risk. So we began to try to do something about that. We asked ourselves the following questions. Are there necessary data to be able to evaluate what is known with regarding to the risk of reusables, healthcare, in healthcare textiles, and the reusable process, namely laundry? Can that information be organized to test this hypothesis that the disposable community has used? Third, how can we estimate the reusable textile risk? And then finally, how might we compare it to something else? So we're going to go through this sort of step by step. The method that we're going to use is that we recognize that in the published literature, journal articles, if you would, there is actually a record of all of the HAI, healthcare acquired infections, incidences attributed to reusable textiles on the laundry system. And then we went back, and Dr. Seeholster did a major effort in this area. We've extended it to the full 50 years. So we're going to select a 50-year period to look at all of the published incidences related to this concept of risk. So this covers 1970 to 2020. The journal articles have to state the patient incidence conditions. And of course, we're looking at both hospitals and long-term facilities in this published record. Virtually all of the studies that we found were actually in the United States and the UK. So we've limited our data and our analysis to those two countries, as you'll see for some important reasons as we go through this. So looking back across those 50 years at the midpoint, which is 1995, the combined populations of these two countries was about several million, and so 373 million, and so we found 10 published events, 10 published articles, if you would. If we look at those articles individually, total them all up, there are 69 patients with the adverse healthcare acquired infections proposed to come from the reusable textiles and or laundry system. So that averages out to about 1.4 cases per year for the US and the UK. So thinking about this a little bit more, we said, well, you know, it could be very underreported. That is, these things occur, but no one bothers to write an article or presents a paper at a meeting or discusses it in any kind of a social media. So we took the number of cases that were reported and we simply multiply it times 100 to, if you would, account for in a conservative way underreporting. So now we have 6,900 patients over 50 years. So we've increased it by 10,000%. So this new rate of reusable cases per day is now about 0.37 related to these reusable textiles. That's about 140 a year. And both Dr. Seeholster and myself and others, looking at everything that we hear, everything that we see published, even in the gray literature, recognize that we are not seeing anything like 140 cases a year of this sort of causality. And so we feel comfortable that we've really got a conservative estimate of this, situation. So in the US and the UK, then the published healthcare acquired infections rate is not published every year, but we found in 2019 that it was about 1.4 million HAI cases. So that's about 3,800 cases per day from all causation factors. So now we have an ability to kind of make a comparison. So we then have the daily HAI rate for all causation factors, and we have it for the laundry related ones, and we simply did a ratio of that, and it says that the probability that the HAI is related to the healthcare reusable laundry system is 1 in 10,300. So what does that mean? How do we compare that to anything? So we actually found it's a pretty high ratio, a pretty low risk, if you would. But we did find that the risk for a person in the UK or United States together of being hit by a meteor, imagine, individual in their entire lifetime is 1 in 9,000. So that helps us reach our main conclusion, which is that the risk of a healthcare acquired infection from reusable textiles is inconsequential. It's very, very, very low. And so the hypothesis proposed by the disposable advocates that reusables are a significant healthcare risk is simply not supported by any measurements. And so that helps us, if you would, put in context one of the first, if you would, one of the first decision factors associated with reusable versus disposables. And so I will turn the discussion back to Dr. Seeholster, who will continue her information about the actual reprocessing system.
Well, welcome back again. This is my part 2 of my presentation, and thank you, Michael, for your part 1, very informative. So we're going to talk about now the laundry role in reusables, and by that we mean reusable healthcare textiles. As part of kind of a let you go home with information that you can use, many folks may not be fully aware of the number of what I consider US guidelines that provide standards for the healthcare laundry process. And the ones that I've noted here and on the next slide are the major ones that basically are used broadly in both the healthcare laundry environment, and also some of these have, shall we say, additional guidelines for the food and entertainment, hospitality sectors. And so there's definitely guidelines for, excuse me, for anyone who is interested in exploring what are the standards for processing reusable textiles. And in this slide, I've issued both the title of the guideline in full, as well as the internet address. So you can, after the presentation, when you're back in your office, you can go to any of these guidelines. They are available free, with the exception of AMY. The ST65 is one that you must purchase, and that's always a bummer, but nevertheless, their guideline for the reprocessing of reusable surgical textiles for use in healthcare facilities is a phenomenal document. It is, well, it is specifically for surgical textiles. There is a good portion of this guideline that pertains to the reusable textiles and other services in healthcare. So I do recommend, if your institution will provide the resources to purchase it, it is an excellent document to have in your bookcase. These are the other two guidances which have been helpful. Certainly the one from CMS is very important for healthcare facilities, because this is where the inspection process from the government kicks in. And so over time, CMS has, shall we say, seen the wisdom of a laundry process that is not exclusively using hot water, nor exclusively using bleach, chlorine bleach. And so we convinced them when I was still at CDC to be a little bit more flexible and allow for lower temperature wash cycles and shall we say batches of laundry that did not need a bleach additive, meaning there were no stains and there was really no reason for the additional antimicrobial properties. So fortunately, they've seen the light and are a little bit more open to uses of different laundry processes. The Hohenstein US document is interesting because they've just modified this as of January 2022, so it is very current. But this one, I have not been entirely sure that it is produced exclusively for the US market, but it's certainly this particular document is in English, and Hohenstein, as you might know, is the Hohenstein Institute in Germany, the one who has been the shall we say, the major player in the European sector for laundry standards and everything there is to know about how the laundry process works, how things are measured, how frequently, and so forth. It's probably one of the first entities that have been active in this field for a long time. But within the last 10 years, they have had in place a, you might say, a field office here in the US. And so this document is probably coming out of the field office with the blessings of the home office back in Germany. Still, it is a very interesting document. It's fairly short, so I do recommend you take a look at it and see if any of its information pertains to your setting. Okay, modern laundry processes. Again, one thing compared to older times, we now have really a high-tech setting for laundry in the modern world. It is highly automated. It is mostly computer algorithm driven. This is for the efficiency of the operation and for sustainable use of water and laundry chemicals. In many instances, laundry plants are actively using programs to recycle water whenever it is appropriate. And again, they're keeping an eye on whether there are a certain amount of solids or maybe microorganism levels in the water. So they do keep an eye on the cleanliness of the water for reuse. And with laundry chemicals, some chemicals can be used in smaller quantities compared to others. That is, they're more active chemically. This is also helpful because there are different, shall we say, fabric requirements for proper laundering. I mean, if you look at the tag on the back of your garments or the tag on the left side seam, you'll see water and chemical indications for use. So they'll tell you whether you should wash this in cold or hot water, or whether bleach can be used or fabric softener. Well, the same is true in the industrial laundry, where if they sort by type of fabric, they can custom blend the chemicals and the water usage and the cycle times, etc., specific for the proper laundering of that fabric. The AAMI standard ST65 is really important because this document gives a healthcare laundry all the instructions and illustrations for how you prepare surgical packs and how you prepare them for sterilization when the time comes. Now, one thing I want to point out, when you look at all those guidelines, you'll find that there's something that's missing. And of course, you can't put your finger on it right away, but I'll tell you what's missing. It's the disposables. Now, you would say, okay, why aren't they being addressed in these guidelines? Well, let's look at it. This is a disposable single-use item. What are you going to do after you've used it? You're going to toss it, hopefully in a receptacle that goes to the proper pathway to end up in solid waste landfill. But that's not something that we address in a reusable fabric laundering system. So disposables are not really part of any of those guidelines. So just bear that in mind. In healthcare these days, there's disposables for almost any kind of function, whether it's a disposable patient gown in a private, physician exam room or a clinic and so forth. There are disposable isolation gowns for the healthcare staff when they're dealing with patients who are in what previously was known as isolation rooms and so forth. Masks that are disposable. Almost any fabric item can be manufactured as a single-use item. But this is something that we experienced during the time of COVID, where if you are dealing with disposable items almost exclusively in some issues, you need to have adequate supply to allow you to continue to perform your service with these disposable items. In other words, if you run out, then what are you going to do? If you don't have adequate reusable garments for the same required function. So next slide, please. So this was something that did happen during 2020 when the COVID-19 outbreak really started to gain traction in the US. And we knew that in general, hospitals were already using reusable PPE gowns and single-use disposable gowns. Obviously, those were the hospitals that were using the reusable garment more than the other, had fewer inventory shortages compared to the hospitals that were using the single-use disposable isolation gown almost exclusively. So when the supply chain collapsed and the manufacturers of these disposable isolation gowns decided to, shall we say, either keep that inventory there at home for their use, or just reduce the amount of these disposable items entirely. It posed a big problem for healthcare facilities in the US. So the Association for Linen Management was approached, and the question was asked, can a single-use disposable PPE item be laundered and reused? So the answer to their question was, yes, you can launder them. But they found that the wash and the dry cycle parameters had to be modified to minimize the damage to these PPE items. Now, the question is, can you reuse it as a personal protective equipment item? And the answer to that is most likely no. So the bottom line is, if you're going to reuse a PPE item, you're going to be repurposing it for some other function, like maybe a protective gown for just preventing your uniform from getting dirty or something like that when you're um, doing surface cleaning or mopping the floors and something like that. But you're not going to be using it for the specific purpose of protective equipment as you would expect for the designation for the single use or the reusable PPE. What I have at the very bottom of this slide are links to 2 open access review articles, which I think you would find very fascinating. And this would be something to consider. Again, if sustainability and being good stewards of the environment is also part of the greater whole, which is the laundry process and the laundry industry and the laundry use in healthcare, this is still something to consider. I will say to our audience, thank you for being a part of our day, and we hope you have some good things to take home to read with a good beverage and so forth. And with that, we'll turn the program back to Dr. Overcash. Thanks again for being here today.
Okay, Dr. Overcash again. I'm going to pick up now that Dr. Seeholster has given us a really good background in the this technology limitations and the standards associated with laundry and the reuse of reusables. I'm going to now move on to the other 2 factors, which I had listed earlier about the decisions between reusables and disposables, which is the environmental sustainability and the economic factors. So examining those things with regard to decisions, we certainly recognize that disposables, to assess disposables, involve how they get manufactured, the design, if you would, the use of those in the healthcare arena, and the end-of-life phase of these systems. The reusables, of course, involve not only the manufacturing of the reusables, but the laundry reuse of these items. And for some of these healthcare textiles involve sterilization as well. And they have a potentially diverse end-of-life scenarios. They don't all necessarily go into the landfill because they have some potential value as materials. So both of the healthcare textile alternatives, the disposable and the reusables, physical products, if you would, have unique architectures, composition, if you would, how they're structured. So I'm going to first look at this environmental sustainability comparison. So I picked the incontinence pads to show you the structure, if you would, the architecture that I mentioned. And so this is important, and I'll mention in just a minute, but let's just go through it. The top, the patient side, if you would, is the polyester brushed knit. There's an absorbent layer, rayon and polyester. Then there's a liquid barrier. I've listed polyurethane here, but there's also a polyvinyl chloride, 2 different versions, if you would, of reusables. And then the bottom, the polyester brushed knit. So this architecture, you know, each of those layers has a different grams per square meter of density or weight. They have, as you can see by their chemical names, they have a different polymeric structure. And hence different supply chains, and they're assembled in the final manufacturing step of the product to form this underpad structure. So how are we going to compare these? Well, we're going to use life cycle technology. This is the, if you would, the international standard for assessing and comparing products. Now, the life cycle technology illustrated in this slide has several pieces to it, if you would. The basic piece sitting in the middle here, I've illustrated, is called the gate-to-gate life cycle. In this case, it's the product manufacturer. How do you bring the materials in and produce a incontinence underpad? But in front of that, the blue arrow is the supply chain. All of the materials that go from the orange one, natural resources in the earth, up through the supply chain to the product manufacturer. That's referred to as the cradle to gate life cycle, whereas the product is just the gate to gate. And then if we look at the use phase, which is in a hospital or a long-term care facility, we have the use phase. And then for both disposables and reusables, there is a final end of life phase, and that's called the cradle to end of life cycle. So we're going to be looking principally at the gate to gates and cradle to gates. To illustrate, this is what we're comparing. This is what we're trying to compile, if you would. The disposables, and this is a gown that has a 57 cycle use phase. The disposables are the big blue pile on the left, and the reusable one is the green one on the right. And so that's what we're going to try to compare within a certain boundary. And so I'm going to show you the boundary for the reusable one here. And you can see the large outside square there. First of all, we have on the left, we have energy. And of course, energy comes from a supply chain. Fuels going into making electricity, fuels going into making heating for a dryer, let's say. And then water is put in and taken out. And on the right-hand side, you can see that none of this is 100% efficient, so we get emissions. Inside of our analysis box then is the underpad, the material supply chain, upper left-hand corner here. Of course, it has packaging, and so the packaging has a supply chain. They come together to give us the new pad. It gets transported to distribution, and finally to the laundry, who supplies the healthcare facility. So the laundry then transports these things to the right, the blue area, which is meant to illustrate a hospital or long-term care facility. In this case, there are 21.7 new pads given the number of cycles, which is about 46, to give us 1,000 pad uses. And so we have 1,000 back and forth between the laundry and the healthcare facility in our analysis. In the laundry, of course, we have the pad packaging, which goes between the laundry and the healthcare facility. We have laundry chemicals. Again, all of these have the supply chains. We have water, municipal water treatment that has to come in. We have wastewater produced from the laundry with the soil in it, and it goes to a wastewater treatment plant to be discharged back to the aquatic system. And then, of course, you can see the arrows show that from the laundry, the packaging, and from the healthcare facilities, the pads eventually go to some end-of-life facility. The disposable version of this looks so much like it, except there isn't a laundry in it. There's the pads, the packaging, the distribution directly to the healthcare facility, and then the arrow to the end of life. So it's kind of a simplified version, but basically a similar boundary. So let me just summarize a number of studies that ARTA has done that look at these healthcare textiles. And this table shows you the textile itself. And then we have the number of reusable cycles. So these are data collected from the field of the actual experience of laundries in terms of their number of cycles, average number of cycles, if you would, for each of the textiles. And then the important last column is the ratio of reusable to disposable in the use phase. So for a surgical gown, it's 1-to-1. You put on a disposable surgical gown or you put on a reusable surgical gown, and they are directly comparable 1-to-1. But for the incontinence pads, you can see the number of cycles is about 46. But in practice, disposable are used at about 2.1 times the number of reusables. And this is acquired, this is data. These data come from hospitals and their total use of reusables or disposables divided by the number of annual annual patient adjusted days. So now we can compare these two on the same basis, and that gives us this ratio of 2.1-to-1. Isolation gowns, 60 cycles, about 1-to-1. Surgical tapes, about 60 cycles, 1-to-1. The cleaning wipes, we're still kind of in the process of getting the final data, but they're on the order of 125 cycles. And interestingly enough, the ratio of disposable reusables to disposal is about 1-to-5. So that has to be factored in that boundary, which I just described to you. And then the flat mops, it's still under study. It may be of the order of 1-to-7. So this is the variety, if you would, but all shows you the common data that are used in the comparison. Number of cycles, and in the comparison, the ratio between disposables and reusables. So what environmental metrics do we typically use? Shown here on the left. And I've put these data here for the incontinence pads. And let's just look, we have energy, two kinds. One is the fossil resources that are combusted to make the energy, if you would, to drive the system, whether it's electricity or whether it's a boiler making steam, making hot air. We have the fossil resources extracted. That's a slightly larger number because some of the fossil resources actually go into the underpad. They're polymers. And so we have to incorporate, we have to add that. Blue water, of course, is our aquatic impact. Global warming potential, CO2 equivalents, our air impact, and then solid waste, our, if you would, terrestrial impact. And so we see the data for the reusables for 1,000 uses. Disposables, remember I mentioned it was a 2.1 factor. So the disposable, again, each of the environmental metrics. The difference between the two, disposable minus reusable. So that's how much higher the disposable is than the reusable. And so if I divide that by the amount of each of these metrics for disposables, I get a % savings compared to the disposables. And you can see the range here, it's almost about 50%, 60%, and solid waste 97%. So pretty huge. So these are the comparisons that we do for each of those textiles, which I showed you previously. Now, let's look at the third factor, which was cost. And we're using a new economic analysis tool. And what we're trying to do is to strengthen the healthcare value analysis professionals in hospitals and long-term care facilities who are looking at adopting reusables by trying to quantify the annual savings. So we built this analysis based upon acquiring direct economic proposals made by laundries to hospitals for long-term contracts, not one-off, do this for the next 3 months and we'll give you a special deal. Comparing laundries, comparing reusables to the cost of disposables. You have to provide that to convince somebody to switch to reusables. What we document is the % annual cost savings, which is disposable minus reusable divided by disposable. And then the first study that we've done is that for the clean room package. And so those data I will show you next. So we have something of the order of 25 cases, as you can see, spread all across the country. So we wanted to make sure there wasn't a regional variation, if you're, that we needed to understand. And then, of course, difference in sizes from very large cases, a number of annual packages per year, to quite small. And so looking at all those data, calculating the cost reduction as a percent, we see that the reusables are just about half the cost of the annual cost, rather, of the disposables. Now, anecdotally, in the industry, people know reusables are less expensive. There's no disposable advocate out there saying it's going to be cheaper to use disposables on an annual basis, because people understand this. This is, however, an attempt to quantify that number on a scientific basis. So let me get to my conclusions then. So let's go through these. First of all, I think what we've discussed is that the scientific evaluation of the healthcare acquired infection risk of reusables is essentially not consequential. Now, this is important because in the COVID-19 pandemic, the shift to reusables is very significant. So this evidence is for a number of organizations for which reusables is a new thing, to help reassure them of the safety of reusables, both short and long term. Second, the evidence continues to grow. Now looking at all of the textiles that have been evaluated, that the reusable textiles contribute directly to the sustainability scorecard of healthcare organizations and or the suppliers, as reduced carbon footprints, water footprints, reduced solid waste, and reduced energy use. The answer is coming back every time: reusables is better than disposables. In addition, there's a confirmation of what I mentioned, where the anecdotal information that the reusables have lower annual costs. And for the clean room package, that was about a 47% reduction. The next economic studies that we're undertaking are to do that same sort of economic evaluation for surgical gowns, isolation gowns, incontinence pads, and the microfiber environmental service products, which are mops and wipes. The next environmental study is to actually look at these cleaning wipes and mops for environmental services and do the kind of detailed comparison that I showed you within that boundary between reusables and disposables. And then finally, to document a higher level, if you would, of peer review, we take every one of these studies and the ARDA library of journal articles, which they refer to as the Assessment of Environmental and Economic Benefits of Reusables, now contain 9 peer-reviewed journal studies published and available for people to use. And so I think that what we're trying to do is to set an additional, if you would, peer-reviewed standard to assure the users of this information that the overall conclusions that you see here, in fact, are pretty consistent and something which we can use going forward. So with that, I'll end my segment of this symposium presentation, and appreciate the audience listening to both Dr. Seeholster and myself as we go through this detailed information. Thank you.
To earn your contact hour of nursing continuing education associated with this session, you will need to take and pass the 10-question true-false test with a grade of 90% or better. To get started, click on or copy and paste the URL into your internet browser to be taken to our CE portal. You will be asked to register, and then you will be directed to the test. If you pass, you will be able to view, download, and save your certificate. If you do not pass, you will have a total of 5 attempts to retake the test. You may store and share your grades and certificates for all sessions in the portal and access them by using the unique links provided at the end of each presentation. If you have any questions, please email me at kelly@healthcarehygienemagazine.com. So while we're waiting for our first questions from attendees to come in, Dr. Overcash, can you describe the fundamental reasons why the reusable textiles have a much better environmental footprint?
Certainly. I think that what we have learned is that because the high cycle frequency for the various textiles that have been looked at, the reusable textiles, and the fact that they only weigh something like 2 to 4 times more than the disposables, that means that where we're recycling things 40, 50, 60 times, the weight of the disposables, even though it's lower, but times 60 is a very substantial number compared to what does it take for us to reprocess healthcare textiles, which is laundry, CDC approved laundry conditions. And so after evaluating that and including the chemicals used to do the laundry, because it's done, it's basically on a kilogram basis, meaning the impact on a kilogram basis, it's easy to see that that number is lower, if you would, times the number of cycles than the number that you get for manufacturing that many disposables.
Great, thank you. It looks like we have another question that came in. Does the environmental benefit of reusables extend beyond just healthcare textiles?
That was an interesting question for us also, because we've certainly done a number of reusable versus disposable in the textile category. So we set about doing a search of all published journals, standard kind of search for any article on reusable versus disposables, a journal, a peer-reviewed journal article. And so we ended up with over 20 or about 20 of these studies, and they range from containers to rechargeable and disposable batteries, other kinds of textiles, catheters in hospital systems. And when we did all 20 of those, we took the data from all 20 of those and put them on a table to look at what the difference was, which one was higher or lower. The reusables, all 20 were lower than the disposables. And so it told us that this fundamental underlying phenomena, which is reusing something is with some significant numbers, I mean, is the key, if you would, to making this substantially better from an environmental perspective, not just for textiles.
Sounds good. And as a follow-up question to that, would that also include cost and environmental benefits? It's less expensive to use reusables?
No, these studies, life cycle studies of reusable disposals have no dollar signs in them. They're just environmental footprints.
Great, thank you. We have another question that came in.
Let me add to that, Aaron, is that ARDA is now recognizing that the work we did in clean room coveralls and clean room devices, gowns, on economic difference between reusable and disposable, where we found that the reusables were about half the cost on an annual basis than the disposables. We're now going to extend that to surgical gowns, isolation gowns, incontinence pads, and environmental services like flat mops and wipes, to again collect those same data, because anecdotally people say yes, on an annual basis the reusables are cheaper.
And one last question. What are the impacts of the study on the risk of reusables in the healthcare environment?
That's, I think, a very extensive impact. And that is that when you look at the principal explanation by the disposable community for selecting disposables, it's Well, the reusables have risks associated with hospital-acquired infections. So we set about trying to actually see whether that was true. And we were able to search for for 50 years, 1970 to 2020, at all of the publications that had any implication that the reusable had created a healthcare problem. And we came up with a number of these things, a very small number, on the order of about one a year. And then we multiplied that times 100 and said, well, what if all of this, if this is underreported, it couldn't be reported by, times 100. So we used that. And then we evaluated how many hospital-acquired infections would have been related to this 100 time the actual number that's been reported. And we compared that to the actual number of HAIs in the hospital healthcare system over 50 years, and the percentage of those which would be attributable to this expanded number for reusables was in the tiny decimal place. It's inconsequential as a percentage of all HAIs. So what it tells us is that is not a defined and, if you would, demonstratable risk associated with hospital-acquired infections by pointing at the reusables and say, well, that's what's causing it. It's just not happening.
We have one last late-breaking question from an attendee. With the growing evidence around reusables, do you see in the near future your work as expanding into other categories or other items?
Certainly in the textile area, both the TRSA and ARDA have a number of products, if you would, that even get outside healthcare. They're in hospitality, they're in other areas of applications, but they're still reusable versus disposable. And so I would imagine that the strength of the results that we found so far will simply encourage us to expand this with other organizations, of course, into other kinds of products.
Here's a question for Lynn. If microbiological testing of healthcare textiles were recommended for all laundries, what would be the implications of doing this?
Well, that's a very, very good question, because there have been associations who have been offering microbiologic testing now for several years. There are other associations that offer microbiologic testing as just a, shall we say, an environmental assessment of the plant's facilities and surfaces. So it depends really on how this testing is to be used. My thoughts about testing of healthcare textiles that have been laundered and dried and are basically getting ready to be shipped to the customer is that when the testing is done, it's not really done at the very last step of the cycle. It's being done somewhat in the 2/3 into the cycle. And we also have to remember too that we're not really dealing with a sterile product here. So we expect there to be microbes on textiles even after they're laundered. There won't be a lot of them. I mean, the whole purpose of laundry is to reduce the amount of soil, organic or inorganic, and microbial burden on textiles so that they're safe for the next patient's use. So I am not real enthusiastic about testing of cleaned textiles, but I understand that some associations, both in the US and elsewhere in the world, have been doing this now for several years and have worked the results and the benchmarks they use into their assessment of laundries and the performances of the process. So I am hesitant to give it a overwhelming, yes, go ahead and do it, but I'm not saying that you shouldn't do it. I think that's entirely up to the hospitals, their points of contact, working with the laundry industry, and what they are looking for in terms of how this process would help them. But frankly, since we're not dealing with sterile products, I'm not really enthusiastic about it.
Here's another question for Lynn. During the laundry process, should healthcare textiles used by environmental services personnel be segregated from those textiles used for patient care?
Another excellent question. As I mentioned in the lecture, both healthcare textiles used for patients and those textiles used in the environmental services part of the overall care do go back to the laundry for laundering, reprocessing. I look at these things from okay, how would we want to best get the best result after we do the laundering and so forth? And for that, if you ever go to tour a laundry facility, you'll get the sense that when the soiled linens come in to the plant, there's a great deal of sorting and segregation of those soiled items. For the garments, the uniforms, bed sheets, the towels, those items will be shall we say, segregated into bundles of textiles according to either fiber type, fabric type, or the amount of soil, primarily. Those are the two major criteria they use to determine that this garment goes in that direction and this towel goes in that direction. The same would be true in a way with the textiles for environmental service use, but I think the soilage issue is different than that for the direct patient care. And by that, I mean, I think you are going to see much higher bacterial, viral, fungal loads on those environmental service textiles, and you also will have a fair amount of shall we say, cleaning and disinfecting chemicals buried in those fibers of those items. So the soil content will be very different compared to the clothing and the surface textiles such as sheets and towels and pillowcases and so forth. So I think it would be a good idea to keep these two batches of textiles separate and going in different directions. Now you may ask the question, okay, well, if we do that, volume-wise, there may not be the same amount of textiles going in the cleaning cloth and mop head direction compared to the other, and that's true. But don't worry about that, because the modern day, very technology driven and state-of-the-art equipment driven that we have in our laundry facilities, they have, in addition to the big tunnel washers, which is where most of the patient care items will be going, they have washing machines, which are called washer extractors, that are the big industrial cousins of the washing machines that you have at home. And these will handle what the laundry industry would consider sort of smaller batches of clothing and textiles. But literally, you could still have, 50, 60, 100 pounds worth of fabric going into those washer extractors. But it allows the laundry to give a highly customized approach to managing different categories of healthcare textiles. And so that's why I think it's probably not a wise idea to mix the two and just randomly throw them in the tunnel washer.
We have an additional question for Lynn. You state in your presentation that it is critical to prevent inadvertent contamination of healthcare textiles. So can you elaborate on how this can be achieved?
That is the critical question, I think, for the laundry industry today. Inadvertent contamination can occur from either the manipulations of the laundered and dried textiles in the laundry facility, or it can occur, say, perhaps while drying. There may be in the intake air, since it's coming from the outdoors, having a higher percentage of its particles being aerosolized bacteria and fungi that we see in the air. That could be another source of contamination. But there also could be contamination in the process of ironing, bundling, and transportation to the hospital. So there's several opportunities for bacterial and fungal contamination to occur. This is why I say testing for microbiology purposes on the laundry after it comes out of the washers and the dryers, but before it gets going on its way to the plant, is prematurely assessing the microbial count on that fabric. The reason why I say this is very important is because in the last 10 years, primarily the outbreaks we have heard about and seen published in the literature have been mostly attributed to fungal pathogens. The most frequently reported has been, according to the EPI investigations, has been members of the Mucorales family of fungi. And that tells me that, again, we're looking at environmental sources of contamination post laundering. So there are several ways we have to think about, one of which is to, again, make sure that the surfaces, including up in the rafters with the blowdowns of the lint and so forth, make sure that the surfaces in the laundry facility are as clean as can possibly and practically be. Make sure that clean laundered textiles are not allowed to touch the floor or a surface that is likely to be has a significant bioburden to begin with. So that's important. I think the most important thing, though, is to dry those textiles to the fullest extent possible, because what we've learned with fungal outbreaks is that they need three things to really increase their numbers. They need, first of all, a source of nutrition. And for some textiles like cotton, that's perfect because cellulose is what they eat. The second is they need a ambient environment that favors their growth. And that would be having a certain amount of available water, such as in the relative humidity, and also a certain amount of temperature from the air. So if it is possible, if we can manage those environmental factors, then we can minimize the growth of fungi on those textiles. If all of that is deemed impractical, and I sometimes think that maybe it could be impractical, then there's one last opportunity, which I'm trying to explore right now. And that is the notion of, for those textiles that are going to the most severely immunocompromised patients in that health facility, we may want to consider putting those textiles in a sterilizer before they're put on the beds or worn by those patients. That way, I think you have the most efficient way of eliminating the possibility that any contaminants on those textiles will cause a healthcare associated infection in these patients. So some of this is, again, kind of thinking in progress. There's no formal recommendation to do sterilizing of these textiles as yet, but I do know some facilities have gone that route temporarily if they've had an outbreak. So I think it depends on whether or not the laundry that has pack room for surgical textiles whether or not they have taken the extra step and cited steam autoclaves there in their facility. But you're right, the vast majority at this point would probably have that last step for sterilization done at the hospitals. But now the pack rooms in the laundries would prepare the surgical packs for the surgical textiles. But you might not need a formal surgical pack style for some of the linens that would be used in the non-surgical patient care. I think that would be a topic that whoever is the point of contact for that healthcare facility to discuss that with their laundry manager. And if so, maybe between the two entities, they could come up with a working strategy for getting at least those packs of textiles ready to be sterilized in the hospital for those at-risk units, such as bone marrow transplant units, NICU, solid organ transplant, oncology, places like that. So again, this is still sort of kind of early thinking, and you'd have to sit down and take it step by step. Okay, what do we do to go this route, and how do we get there? So that's where we are.
Great, thank you. So that's about all the time we have today. If you have any additional questions, please send them to me at kelly@healthcarehygienemagazine.com, and we will do our very best to get them answered by our presenters. We will also include them in a transcript of this Q&A that will be available for download shortly. We thank our presenters and we thank all of our attendees for your time today, and we'll see you at the next session.